Ladies and gentlemen, we are all set and ready for the first lecture for today on Hormones in Aesthetics. Let us put our hands together to welcome Datuk Dr. Selvam to be on stage.
Good morning. I know it's cruel to bring you all here on Sunday early morning, but we are also cruel. We are so addicted to teaching that we wake you up early and make you come here. Okay, so this lecture is a slight deviation from health to beauty, which is actually necessary, both for men and women. But as I said yesterday, if you notice sign of aging externally, that means you are aging internally. So taking care of the physical appearance is necessary if you are not so inclined towards aesthetic reason, at least for health reasons. The question is, what do you want to do? We don't involve ourselves in aesthetic teaching. So we won't be talking about Botox and fillers and laser treatment. But there is a lot actually you can achieve to maintain a youthful look and youthful appearance, feeling young and energetic, just with nutritional medicine and hormone therapy itself. Okay? So you need to look at certain things if you want to improve the physical appearance. So first of all, you need to maintain good muscle mass because that supports the skin overlying it. Number two, you'll have to understand why you get wrinkles, what you can do about wrinkles. Then you need to know about sagging. These are the obvious signs. Of course, then you can look at fat accumulation. You can look at dry skin. You can look at thinning of the lips, sunken eyes. All these are signs of aging. It happens. We are not here trying to tell you that you will not age. We are going to age. And there will be a day that you will have to leave this physical world. But what we are trying to tell you is that you can maintain better health until the last day. Okay? So before I proceed, there's a short announcement which I forgot on the first day. One of our colleagues who used to be here every conference, Dr. Thangam Silva, he unfortunately passed away recently. And it was quite surprising. He always sits in the front row, very pleasant gentleman. You'll remember the tall, well-built person. Unfortunately, he had fibrillation. So can we just observe a moment of silence for him? Please rise so that his soul may rest in peace. Yeah. Okay. So in Saham, we train doctors to recognize borderline deficiencies. Now, if you want to learn how to correct hormones, there are a few slides in the next lecture I'll show you. You must recognize borderline deficiencies. This is the difference between us and those who are not trained in hormone medicine. And this is a difference between us and even the endocrinologists, because conventional teaching is you must be either below or above the reference range. Okay? I've said this before, the reference range is often too wide, and it is not done on healthy volunteers. It is taken from samples and an average is drawn. But most of people who test their bloods are people who are not having the best of health. So it doesn't tell you much about optimum health. So when we train you in integrative medicine, we always tell you that you must maintain optimum levels of what you need. If you want to be within the reference range, you can be healthy, but that's not what we want. We want to be optimum. So in order to be optimum, you have to maintain your hormone levels not just within the reference range. Most of the hormones, except of course insulin and estrogen, you have to be in the 25th centile. That means it's roughly about 75% from the upper limit. Do not fall into the trap of just observing the reference range. An example would be, say for example, if you take free T4, the reference range in the lab that I use is 9 to 25. So the conventional teaching is, as long as you are within the range, you are euthyroid. Correct? But 95% of the patients that you see and test will be within the reference range. And a lot of them will be having symptoms of hypothyroidism. Very typical: cold hands, cold feet, lethargy, dry skin, hair loss, inability to conceive, and so on. Why do they have? Because the level is not optimal. So you need to correct deficiencies and achieve until you have reached the optimum level. So if you accept the reference range, you will not correct borderline deficiencies. So these are borderline deficiencies, but with clinical presentation. So you need to correct. Conventional medicine will only correct thyroid if it falls below 9. And most patients, when they are below the reference range, they are already at the end stage of life. They are sick people. Probably they are the ones who have a late stage of cancer. Those who are in ICU, septicemic, they are already very sick. You do not want to wait until that stage. So learn how to recognize borderline deficiencies. So why do you age? Which comes first? Hormone deficiency comes first, or aging starts first? Hormone deficiency starts first. That leads to aging, because we now know that hormones tend to decline from the age of 25. So what you want to achieve in health is between 18 to 25. Start with healthy childhood. Of course, as I said, is preconception health, intrapartum health, neonatal, toddlers, adolescents. That is the best time to achieve what you want in later life. So hormone deficiencies seems to be starting very earlier now than before. My father lived up to about 93. Even at that age, he had big biceps, full of hair, a lot of dark hair, very muscular. So this is what was happening before, which we don't see now. So it's good to understand that we are not enjoying good health. So it's better to pay attention to nutritional deficiencies and hormone deficiencies. So you get hormone deficiencies in children? Yes. Newborns? Yes. Newborns, especially thyroid hormone deficiency. If you see a newborn or an infant with less scalp hair, that's a sign that the mother would have been hypothyroid. And you go back and ask the history in the mother, she would not have lactated well, the baby would have had probably neonatal jaundice or respiratory distress syndrome, or they are frequently sick. These are signs of hypothyroidism, which is not uncommon. Not uncommon. So you do the TSH from the cord blood, but if any one of the signs suggests hypothyroidism, you just have to repeat, because it could be the maternal one. So you have to repeat to confirm hypothyroidism. Would you correct hypothyroidism in newborn? If it exists, yes, because it's very important for health. Would you correct hypothyroidism in children? Definitely so. Okay. This is one hormone you should not hesitate to correct. Some children can also be deficient in cortisol. They will be the irritable children, and they will be often sick. But I do not correct cortisol. If at all I correct, it's a small dose for a short period of time. What they need is change in diet and lifestyle. Children must sleep early. They must sleep at least for 12 to 16 hours, newborns. My mother used to tell me that when we were small, little ones, we used to sleep 16 to 18 hours. Now newborn babies don't even sleep 10, 12 hours a day. So a lot of things have changed. So sleep is very important. Changing the diet, moving away from gluten and sugar and dairy products to have healthy adrenal gland would be important. So cortisol is not so often used. Thyroid could be used. So we look at how correcting hormone deficiencies can improve your physical appearance, wrinkles and firmness, etc. So this is a typical sign of premature aging. She's only 58, she looks much older. What do you see here? Okay. Then you see these eyelids are sagging. You see these wrinkles. You see this nasolabial fold that is sagging. You see thinning of the lips. This is sagging. Lots of wrinkles. So this is a sign of premature aging. You shouldn't look like this at 58. Correct? And there is also loss of small muscles, atrophy. This is not very clear, but she has lots of age pigments, which could be cortisol deficiency or poor detoxification. So you don't have to be like this, but many of us or many of your patients will say, this is aging, this is normal, why disturb it? Then leave it. But some people would need to understand that correcting this physical appearance will help them to live healthier and longer. You can even reverse diseases. Yeah? Okay, look at wrinkles. Why do you get wrinkles in the skin? Because you lose the thinning of epidermis, thinning of the dermis, loss of elasticity and dehydration. So when you want to look at wrinkle treatment, you have to look at hormones and your nutrients. Keep the body alkaline. Alkalizing the body pH is very, very important if you want to have good skin. Okay? And of course, smoking increases wrinkles. I need to ask these people who are in some of the countries where they were smoking until 120 years whether they had wrinkles or not. Somebody mentioned yesterday. So hormones and wrinkles, these are the hormones that will help with wrinkles. The most important would be growth hormone, vasopressin and aldosterone, if you want to reduce the wrinkles or delay the wrinkle appearance. So these are the hormones that you need to look at. We'll go through one by one. So this is a typical sign of growth hormone deficiency with wrinkles and also sagging. But of course, this lady has sunken eyes, lots of wrinkles and dehydration. All this. So this is a typical sign of growth hormone deficiency. I have more slides on growth hormone deficiency. Now, if you are deficient in growth hormone, of course, there is another sign. The patient tends to be the anxious type, growth hormone deficiency. And growth hormone deficient people, if they sit down quietly, they will realize that they are not peaceful. It's always something that's empty, the kind of vacuum feeling, even if you have everything. So these are people who also will find it very difficult to sit down and meditate. On the other hand, meditation is one technique that increases growth hormone. This is why people who regularly meditate, they look so good and they live longer. One way of increasing growth hormone is by meditating. But when you are deficient in growth hormone and cortisol, it is difficult to still your mind. Anyway, growth hormone deficiency, you will get wrinkles on the forehead, droopy eyelids that I've showed you, sagging cheeks, nasolabial folds, dehydrated skin, and fine wrinkles. And you can do the pinch test. It doesn't snap back easily. So these are the signs of growth hormone deficiency. So when you replace growth hormone, you will reduce the wrinkles, especially sagging. Sagging is a typical sign of growth hormone deficiency. I've got some nice slides to show you, and it improves the skin elasticity. Okay? What do you do to increase growth hormone besides taking growth hormone itself? Yes? Sorry? Yes, because it makes every cell works better, because I love glutathione actually, because that's probably, I call it the sentinel of life. But you need to stop sugar. Sugar, high blood sugar, insulin will decrease growth hormone levels. Sleeping late will decrease your growth hormone levels. A lot of things happen in your body between 12 a.m. and 12 midnight and 3 a.m. If you want to produce hormones, you want to produce antibodies, you want to detox, it happens during that time. But most people sleep very late. So you don't get the benefit by sleeping late, even if you sleep for 10 hours. Then you have to do weight-bearing exercise. Then do some meditation. These are the natural ways of increasing growth hormone. Now, how much growth hormone to be used? We use sometimes growth hormone in children if they have very short stature, if you want to increase the growth. I've got a girl who has grown significantly because this girl had lots of sepsis in the brain and most of her hormones are disturbed. So her speech is disturbed, her gait is disturbed. So she's on growth hormone. These are exceptional cases. But if you want to use growth hormone in children to increase their height, you have to use it before the age of 12. But it's very expensive because the dose is high. Generally, you don't have to buy a growth hormone that you have to dilute the powder form, because you need to observe strict sterility. It's better to buy a pre-filled pen like the insulin pen, and the dose varies from 0.3 to 1 milligram. And if you use the pen, usually this is how we titrate. For men, you use 3 clicks, so it comes to about 1 milligram. For ladies, it's between 1 to 2 click. The easiest pen that can be used, very practical, is the one from Novo Nordisk. I'm sure it's available in most countries. Novo Nordisk, that's the company. I'm sure you can find it in most countries. This is the easiest and most practical growth hormone injection pen that I found. So for women, it's about 1 to 2 clicks. And for men, it's about 3 clicks. But if you are using it in diabetic patients, do tell them that the blood sugar will go up initially for the first 1 to 2 months. Not by a lot, it can increase. But after that, it will settle down. Because growth hormone firms up your muscles and helps you to lose fat. So that will improve the blood sugar levels. So the next hormone is vasopressin. Now, this is an antidiuretic hormone secreted by your posterior pituitary gland. The main action is to retain water in your cells. Dehydration is a problem as we age. You can drink lots of water, but it doesn't get into the cells. Improving dehydration is, if you drink alkaline water, it has a possibility that it will increase your skin hydration. And adding some salt, a pinch of salt, like rock salt or organic sea salt, will also help to retain water. But there are 2 hormones that help you to retain water in your cells. One is vasopressin, the other is aldosterone. The difference is aldosterone is from the adrenal gland and that retains salt and water. Vasopressin is from the pituitary gland that retains water. How do you diagnose vasopressin deficiency? I don't do the blood test. Nocturia, passing urine frequently, especially at night. Of course, for men, aging men, you have to rule out prostate hyperplasia. This is one typical sign of deficiency in vasopressin. The other sign is the fine wrinkles on the forehead and what we call as crow's feet. You get the wrinkles around the angle of the eyes that I've shown you before, and sunken eyes. So the eyes are like in deep pockets. So one reason is dehydration. The second reason is if you are cortisol deficient. Okay. Of course, in cortisol deficiency, you also have the dark circles, and you can have dark pigmentations on your knuckles. So this is a sign of cortisol deficiency. So think about vasopressin if you want to maintain the plumpiness on your face, especially the face. If you want to reduce the wrinkles, actually a lot of this will disappear if you have enough vasopressin. So it is beautiful to have an eye like this. So go and look at yourself in the mirror after this lecture. See how many of you have this type of beautiful eyes. I think most of us will be somewhere here. Very worried look, anxious look, deep eyes, lots of wrinkles, sagging. Look at this sagging, yeah? So this is a typical sign of vasopressin deficiency. So this is the crow's feet that I mentioned. Fine, sharp wrinkles. And you'll be surprised what you get when you correct the vasopressin deficiency. This is another slide, but there's a lot of other wrinkles as well. You see the eyes, so deep. Yeah? Now the dose of vasopressin, you can get it from compounding pharmacy, would be 50 to, it comes as 100 to 150 microgram tablet. You need, it's available from Ferring Pharmacy, and the product is called Minirin. Minirin, Ferring Pharma. Ferring, Ferring Pharma. The tablet is sold as Minirin. It is 150 micrograms. You just need half the tablets and take it at night before you sleep. Okay? Now the next hormone is aldosterone, and this is a mineralocorticoid because it retains salt and water. The typical sign of aldosterone deficiency would be hypotension, especially in this vertical position. So they will feel giddy, they will have low blood pressure if they stand up, they will feel better when they lie down. And it makes them feel very tired. You ask them to stand and lecture, they won't be able to do it for long. Like Carol gave 3 lectures yesterday, standing up, at that age celebrating birthday. So you should be having enough aldosterone. Otherwise, it will be difficult for you to stand. This is a typical sign. You have low blood pressure, and because you don't retain water and salt. But it prevents dehydration of the cells. So you have better skin if you correct this. So the aldosterone is available from the compounding pharmacy. I don't think so it's sold outside. Here you can order as fludrocortisone, and the dose would be anything between 100 to 150 micrograms a day. It can be in the form of a capsule. Just keep an eye on blood pressure, but the amount of salt that it retains, the amount of water that it retains does not lead to high blood pressure. But you don't have to take excessive dose. 100 to 150 micrograms to a maximum of 250 would be sufficient. Now, estrogen is the hormone for women. That's why they have less wrinkling. They seem to age a little bit slower than men in wrinkles. Otherwise, they also age like us. But when it comes to menopause, there is accelerated aging because there is a very sharp decline in hormones. But the best time to correct the hormone deficiency is not to wait until menopause, when you have the signs and symptoms and you need to have the bloods done. Whenever you correct the estrogen, you must always combine it with progesterone. Never give estrogen alone. Do not ever do this. Okay? So you will have dry skin. There is definitely epidermal thinning and skin atrophy. Dermal thinning secondary to decreased collagen. Estrogen helps in the formation of synthesis of collagen, especially if you have enough vitamin C and glutathione. Okay? And there is decreased skin elasticity if you are deficient in estrogen. It's not so much in men because you need very little. That amount won't make a difference. And we men do not take estrogen. We want to suppress the high levels of estrogen. As you age, men, our problem is too much estrogen and too little testosterone. So this slide is meant for ladies, not meant for men. Okay? You are not going to try estrogen because you want to have better skin. You know the slide I showed you, the lady with beautiful eyes? Women tend to have that kind of eyes. Yeah? At younger age, maybe some of you even at this age. That is because of estrogen as well. We don't seem to have that. So that's an advantage of being a female. Now, menopause accelerates wrinkling. Topical estrogen increases firmness of skin and decrease wrinkles, especially this type of wrinkles. Estrogen deficiency, testosterone deficiency, and growth hormone deficiency, you can have vertical wrinkles, vertical lines on the lips. These are the 3 hormones that causes the thin vertical lines on the lips. Yeah. Of course, there are other aesthetic treatment. You inject hyaluronic acids and so many things that is done. Yeah. There's a treatment that is what do you call gold threading? Is it? You know how it's done. It's frightening to hear. You have to put a needle with a gold thread somewhere here, and then you pull it up and you put a stitch and it stays there just to give you the lift. And now it's very trendy here that women go for lengthening the chin. So the chin becomes very sharp, and it's quite common among ladies. Suddenly you see they have sharper chin. Yeah, so this is the craze. Recently there was one of the South Indian actress who went up to North in the Bollywood, and she's also quite well known in Hollywood. And she died, unfortunately, at the age of 54. She looks, for her age, she used to look very well, very good. But it's a lot of effort, to keep that fat down, to keep looking good, and apparently she died of ventricular fibrillation. You know what happens when you take a lot of this treatment? That itself doesn't put you into deep trouble unless it's something to do with infection or wrong procedure or because of liposuction. But when you take weight loss formulas, they can cause a lot of tachycardia if you take excessive loss. And these people, if there is an event or function coming up, they want to lose so much of weight so fast, so they up the dose. And she died miserably in the bathtub. And you're so famous and you have pots of money, but you lose your life just like this because you pay so much of attention to only the aesthetic, external appearance rather than focusing on internal health. So this is the fine lines that I told you. Sign of estrogen deficiency, growth hormone deficiency, and also testosterone. But you can see the thinning of the lips. Most of us don't notice if the lips are getting thin. If your lips are getting thin or it gets sunken, then it is hormone deficiency. Progesterone has direct effects because it increases elasticity, firmness, and wrinkles. Indirect effects because it reduces the sympathetic overactivity. Progesterone is a very calming hormone. So if you use progesterone if you prescribe progesterone for a woman, ask them to take it at night unless it's a BD dose because it improves sleep. And progesterone, because of the calming effect, can also help in high blood pressure. But I'm not suggesting men take. Do men take progesterone? No. Any men here takes progesterone? Yes. Ashley takes. Why do men take progesterone? Sorry? Progesterone blocks the conversion to DHT. Oh, I'm not aware of that. There is an enzyme that blocks that, I'm sure. Why men above the age of 50 we take progesterone is because it helps with your prostate health. You just need a small dose. You need 100 milligrams. You can even take on alternate days. So do I take progesterone? Yes, I take. Is it a female hormone? Yes, it is a female hormone. Do men have progesterone? You have. Almost all the hormones you have in both sexes. The only difference is the amount. So men need progesterone after the age of 50 to help with their prostate health. So this is how progesterone works. Now testosterone, the main action of testosterone is to firm up the muscle. So it benefits what is above the skin and what is underneath the bone. Yeah? Women need testosterone? Yes. What happens if you don't have enough testosterone? This hormone has significant effects on the brain, the bone, the muscle, the heart, and the sex life. So this is why we call it the king of the hormones and hormone of the kings. If you don't have enough testosterone, you cannot be the king. I asked a question, why women are not the kings? You please don't overdose yourself if you aim to be a king in any country. It will put you into trouble. How much testosterone women need? Men need 10 times the dose. So if men needs between 100 to 150 milligrams a day, women would need about 5 to 10 milligrams. Now when you replace testosterone to women, just give them this piece of advice. If they notice there is hoarseness of voice, or if they have facial hair, increase in facial hair, or if they have loss of scalp hair, stop the hormone and then give time for a month or so. When the hair loss has dropped half the dose, you don't have to stop the treatment. They still require if it is going to be beneficial, and if they are deficient, you just have to half the dose. And for women, when you apply the estrogen cream, the leftover you can apply on the face, especially on the lips, to reduce the hair growth. Estrogen can reduce the facial hair in menopausal women. Apply a little bit on the face, especially around the mouth and the lips. So it reduces muscle atrophy, reduces skin dryness, and increases sebum. Important for keeping the skin well moistured. And the other hormone that does this is DHEA. But excess, you will have too oily skin and pimples. So it reduces fine wrinkles, vertical wrinkles on the lips, and thinning of the lips. It's same. Anywhere, any muscle will undergo atrophy in testosterone deficiency. DHEA, not much of an effect on skin, but it helps to prevent dryness and improves facial color. Melatonin, there are companies that make what you call facial creams with melatonin. Why? Because melatonin, when applied locally to the skin, it acts as an antioxidant, local antioxidant effect. And because melatonin receptors are found in keratinocytes, melanocytes, and fibroblasts, so we know melatonin has significant effects on the skin directly, indirectly because it reduces free radical damage to the skin, and melatonin increases growth hormone. So how many of you take melatonin to get better sleep? Okay, the rest of you don't take? Why? Because you have good sleep? Oh, sleep like a baby? Oh, very good. But can you still take if you enjoy good sleep? In my opinion, you should. Aging people should take melatonin. It's a very small dose. The best way to take melatonin is to use the sublingual form and a very small dose. Each sublingual tablet is 3 milligrams. You can start just with quarter, just before you sleep. Avoid phone and any blue lights in the room. Switch off the lights. If you wake up and you want to sleep more, you take another quarter. If that quarter is not sufficient, you increase to half. If half is not sufficient, you can go to 1. And also good when you travel to reduce the jet lag. But if you overdose yourself, you will have deep sleep for about 3 hours. You wake up, you will be unable to sleep. That is overdose. If it is underdosed, you don't have deep sleep. So you can adjust the dose, but it is good to take because it reduces the risk of nocturnal hypertension. It is a very, very powerful antioxidant hormone. It protects, it reduces the risk of cancer, and it scavenges free radicals. So this is something that we can consider. It is safe, non-toxic, except if you take excess dose, it disturbs your sleep after about 3 to 4 hours. So you need to sleep early if you want melatonin secretion, and you must have vitamin D3. Okay, because we lack sun exposure, most of us have problems with sleep as you age, and the reason for increase in depression is also because of lack in sun exposure, D3. So supplement with melatonin, the best way is a sublingual form. Smoking, we know it increases wrinkles. Now HbA1c is a problem. This is because it's just a cross-linking between glucose and protein. It's a test that you should do routinely. Keep the levels at or below 5 to 5.5, not above that. And the way to keep it down is to reduce your carbohydrates. That is why diabetics, they age much faster. The problem is it's not only about the skin. It's like a rust in your body. It causes inflammation. It creates a lot of free radicals. This is the end product in people with high blood sugar or high carbohydrate intake diet that causes end organ damage, whether it's kidney or your nerves or your eyes or the heart. It can have significant systemic effects. And one of the reasons for premature aging and a lot of wrinkling. And the problem with HbA1c is once it's formed, it will last for 120 days in your body because it sits inside the red blood cells. It cannot be reversed. It's going to be permanent inside the cells, and it cannot be metabolized or eliminated until the red blood cell dies. So you don't want to have too much of this because it affects the brain as well. The way to reduce is reducing your carbohydrate intake, but for those who have excess elevated levels of HbA1c, carnosine will be helpful. And the active form of thiamine, it's known as benfotiamine, that will be useful as well. These are the two supplements will be useful for people with elevated levels or increased levels of HbA1c. Free radicals, yes, definitely they'll increase. The oxidative damage to skin and internal organs, this is where antioxidants play a role. It is good to focus on water soluble, fat soluble, as well as intracellular antioxidants. I'm sure all of you all know, right? Okay, vitamin C, vitamin E, alpha lipoic acid that works both in both the environment, and glutathione for intracellular. You don't have to focus much on catalase or SOD because if you have enough glutathione, it activates the rest of the intracellular antioxidants. So why do you get too much of free radicals? Look at gut dysbiosis, chronic infections, including dental infections, heavy metal toxicity, overexposure to sunlight. Actually, sunlight and the association with melanoma. We don't advise sunburn, but one of the reasons why sunlight increases melanoma risk is because you have oxidized fats in your skin. That increases the risk of melanoma with overexposure of sun. Because, you know, the trans fats that is consumed, that is the reason. Good cholesterol does not get damaged unless you get regular sunburn. Yeah. So now it's how to shape your body. So you don't want to lose your skin elasticity, you don't want sagging, you don't want accumulation of fat, visceral and non-visceral, you don't want cellulite, you don't want atrophy of muscles, and you don't want loss of muscle volume because it will change the shape, correct? So you want good look on the face, you want good shape. Okay. So loss of collagen and skin hydration, mostly because of you need to focus on growth hormone and vasopressin as well as aldosterone. So if you have this, then if you have, this is contributed by also lack of anabolic hormones to maintain muscle tone and volume. So if you want better skin elasticity, this is what you focus. Then sagging is mostly because of growth hormone deficiency, and it also could be because of loss in muscle volume. So you can have sagging of the cheeks, loose skin under the chin, loose skin on the neck, sagging of the breast and abdomen, draperies on the back, skin folds on the thighs, and this is mostly by growth hormone. Okay, this is how it looks. You see the sagging? You see this sagging? This sagging? This is sagging. Yeah. So this is sagging. Of course, this is a picture of before and after. I don't have the details. I just put the difference, put the picture to show you the difference. This is a lot of sagging. The whole face has sagged. This is typical sign of growth hormone deficiency. This is sagging. Sagging. This is the drapery on the back. Nice curtain on the back. Again, learn sewing lessons from this. Yeah. This is sagging. Okay. But of course, it is not a problem if you have the BRCA2 gene, because then you can have mastectomy, like Angelina Jolie. Yeah, I'm just joking. But if you have enough growth hormone, you don't see much of this. And you also have thinning of the lips and vertical lines. It's nice to have plump lips. Now, fat, why do you get accumulation of fat? Remember, insulin is very, very important for life, but excess will convert the sugar into fat. Insulin is a lipogenesis hormone, so it accumulates fat. When you become hyperinsulinemic or insulin resistance, you just accumulate fat. Testosterone deficiency, growth hormone deficiency, hypothyroidism. In men, excess estrogen. In women, estrogen deficiency. DHA deficiency, yes, but not in a very significant way. This is induced Cushing syndrome. Yeah, it's induced mostly because you use synthetic testosterone. So these are the reasons why you accumulate fat. The first thing that you should do is to cut down carbs. Either you go on a ketogenic diet for a certain period of time, or you go on the low-calorie diet and exercise, correct the nutrients, and especially hormone deficiencies. Okay. This is central obesity, very common. So it stops here. I don't know where else it's going to go. So look at insulin, testosterone deficiency, and growth hormone deficiency. Yeah. Of course, he has gynecomastia. So this central obesity, as you all know, increases the risk for serious medical conditions. Diabetes, high blood pressure, metabolic syndrome, and cancers. Okay. The way to reduce this is starving yourself not to death, starving yourself from carbs. That's as simple as that. You cannot cut down carbs drastically, doesn't matter. You make it a point to keep reducing gradually until the carbohydrate portion comes to about 10 to 15% of what's on your plate. You don't even have to measure anything. 60% vegetables, 20 to 30% as proteins and good fats, and 10 to 15% as carbs. And the better way to do is have a ketogenic diet for breakfast and dinner, have the carbs for lunch. That's even better. So it's not difficult. But once you have this fat, very, very difficult to get rid of it. So it needs a lot of effort, and exercise, especially the abdominal exercise, need to be done regularly. It's painful, it takes time, but it gives you the results. The best way to exercise tummy, these abdominal muscles, not because it's not easy to get the six packs, very difficult. But you can reduce significantly. You just have to follow any one of the YouTube exercises for abdominal exercise. There are many types of exercises, and they are very effective. You don't need machines. So, very common sight. Must be a very, very rich guy. Yeah? Okay. Cellulite, nobody likes this, women. Growth hormone deficiency, testosterone deficiency, thyroid hormone deficiency, and hyperinsulinemia. So if you go for liposuction, well, if you want to try, you go ahead and try, but there is always a risk. But if you do not treat the underlying cause, it is going to accumulate again. And this is what you see in aesthetic medicine. Yeah? Am I right? But what will it lead to if you do not correct the underlying cause? This is premature aging, diabetes, heart problems, osteoporosis, memory, hair loss, and hypercholesterolemia, poor immune system. This is cancer and diabetes. So the root cause is important. I just met one of the doctors here. Sister has 5 to 6 centimeter size cyst in the ovary, and she was advised cystectomy, only 25 years of age. Well, go ahead. If it is a huge cyst, symptomatic, or if it is malignant, remove. But the thing is that if you do not treat the root cause, it is going to come back, either in the same ovary or the opposite side, or you can get a fibroid in the uterus, you can get breast problems, you can have miscarriage, premature labor. So it's going to add on, and the list is only going to get longer. So treat the underlying cause, and this 5-6 centimeter cyst, benign cyst, they don't need any kind of surgery. All you need to do is balance the estrogen and progesterone. Any cyst in the body could be because of iodine deficiency. Okay. Now, dry skin is also very common, especially in aging people. I didn't put a slide on age pigments. I should have added that. So anyway, dry skin could be because of thyroid hormones, estrogen, DHEA, and testosterone deficiency. You could be deficient in vitamin E and A. So what I do is, usually I make sure that these hormones are balanced, and I make sure the patient gets enough essential fatty acids, especially 3. 6 also has a beneficial effect, and now we know 7 has got a good effect on skin, hair, and nails. But after this and this, if the dry skin persists, you need to consider vitamin A and E. Okay? This omega-3 is a generalized dryness. Omega-6 is especially what you see, like the flaky kind of skin on the legs. So that is a typical sign of omega-6 deficiency. Fat loss on the face can be because of growth hormone deficiency, insulin deficiency, or cortisol deficiency. Cortisol deficiency is very typical. You get hollow face. And of course, the hollow face will come with the anxious look. So the hollow face can be because of loss of muscle volume because of these hormones. So you will have to look at hormones, especially if it is associated with anxious look, then it is very likely to be cortisol deficiency, but it's a combination. You can see it is very hollow, very anxious look, but there are wrinkles and there are sagging. So it's a combination. This sagging may be because he wore maybe a 2-kilo earring. I see a big hole there, maybe it's because of earring. He had the fancy big earrings, and that could be the sagging, because ears do not sag often. If you go to villages, I'm sure it's in India, Indonesia, even in Tibet, and you can see Africa also same, the ladies have a lot of heavy weights on the ears, and that sags. Usually it is not because of hormones. So it could be because of cortisol deficiency and loss of fat and muscle as well. Double chin, think about insulin and think about too much insulin and too little growth hormone. When you have high insulin, almost always your growth hormone is going to be low. Gynecomastia in men could be because of excess estrogen, and too much insulin. And it's not in men, it's also in boys now. Yes?
Yesterday, one of the presenters mentioned using progesterone and applying something. Does it really work?
Yes, it works. If you have young boys coming to you with gynecomastia, of course, you're going to sit there and tell the parents or the boy about diet, the sources of estrogen that I mentioned yesterday, xenoestrogens, and it will have an effect from further enlargement. But you want a physical reduction, right? So that is how the progesterone helps. You try on your patients and you'll see the difference. This is, young girls get very disturbed if they have unequal breast development. I mentioned this yesterday. This is a girl who was hypothyroid. Yeah? So this is how she was before, and this was after the treatment. So thyroid hormone deficiency can lead to unequal breast development in young girls. Okay? Estrogen deficiency on the breast is because it's small, it can be sagging because of growth hormone deficiency. This is, I believe, is more of self-induced problem. They want to be thin like this for whatever reasons, many possibilities. Can't be anorexia, she doesn't look like she's having anorexia nervosa. Could be insulin and cortisol deficiency. Insulin is very important to transport your amino acids, potassium, and probably other minerals into the cell. That is why you need, besides sugar, glucose. So if someone is insulin deficient, they will lose muscle in spite of having sufficient amount of protein because the drive force is not there. So they can be thin. And diabetics, when they start to lose muscle, it's likely that they are becoming insulin deficient, from hyperinsulinemia to insulin deficiency. But cortisol deficiency or forced starvation to look like this. Yeah, so it's not everything that you see, it may not be because of hormones. Sometimes it's just forced because they want to appear like this. And this is a craze now that women want to have prominent collarbone. This is the trend. You can see the actresses, especially the Hollywood actresses. They all want to have prominent collarbone. So what we do is, because we follow what every American does, so women are very particular. They must see the collarbone. That's the fashion. This is, I believe, self-induced. So insulin deficiency, you can have this. But there could be other reasons as well. So definitely this guy is not going to lift this weight. Yeah, he's just aiming to lift. Look at methylation if you want to slow down aging, if you want to slow down pigmentation on the skin, if you want to slow down your wrinkles. Methylation is very important, so look at homocysteine. Always measure homocysteine and insulin in your patient's fasting. It can help with wrinkles, delay graying, improve muscle tone, and nearly all age-related diseases. So when I see high insulin and high homocysteine in my patients, I'll tell them, diseases, no need to think. Just think about A to Z. All the diseases between A to Z is more likely if you have these two levels high. So the necessary supplements would be B vitamins. You know by now, B6, B12, and folate. The activated form is better. If it doesn't bring down, then you may want to consider SAMe, TMG, choline, magnesium, zinc. Usually patients would try B vitamins first, unless the level is very high. So there are other things that help. Having adequate levels of glutathione, the intracellular antioxidant, is definitely helpful. If you have enough glutathione, say you correct glutathione deficiency in someone, you correct the deficiency, what would you see is often an increase in energy within 2 weeks. This you should see if you have the right formula. Then you should see a better sleep. Then after a month or two, you will notice whitening and firming of the skin. You don't need intravenous. And of course, it helps to improve osteoarthritis and many other conditions, provided you just take the precursors. Do not take the glutathione molecule itself. And of course, glutathione deficiency is associated with many, many diseases. There are hundreds of articles available on these scientific papers. So what would you want to do? You want to check the hormones that I've mentioned. You can check the blood, you can check the urine, you can check the saliva. I still stick to blood because it's convenient. Put the needle in, draw as much blood you want. They don't have to keep collecting saliva. Of course, each one has its benefits. The urine, you can test metabolites, but you can't test some of the hormones. You can't test growth hormone in the urine. Saliva, you can check the hormones as well as metabolites. You will require a few collections a day, useful especially if you want to measure cortisol. Just collect the saliva at different times of the day. You can't check all the hormones again because you can't check like growth hormone in saliva. So for practical reasons, I still do bloods, but you may want to do a combination of blood and urine or saliva and urine. It's up to you. But check the hormones, but always include insulin and homocysteine. CRP will give you an idea on the inflammation in the body. So how do you manage patients? You can prevent, you can treat by correcting the hormone imbalances, ensure adequate sleep. Stress management is very important, regular detoxification is important, and exercise. Okay. So this regular detoxification you can do many ways. You can do fasting. You can fast once a week, fast the whole day with only fluids. It can be just water with lemon juice or just vegetable juicing, just 24 hours. You can do intermittent fasting, eat for 8 hours, don't eat for 16 hours. It's not too difficult. It sounds difficult, it's not actually. Say if you have late breakfast at 10 a.m. So you have 8 hours, right? So you can eat until 6 p.m. Then you don't eat anything until the next morning, 10 a.m. So you eat 8 hours, 16 hours you don't eat. But sometimes you get the advice that you can eat anything within that 8 hours. Don't do that. It is better still to have a low-carb diet. Don't just dump everything because you're not going to eat for the next 16 hours. Doesn't serve the purpose. And you can also do detoxification. There are many ways. And look at antioxidants that can help you to detoxify as well. Supplements, glutathione precursors, amino acids will be helpful. Vitamin C is very helpful to maintain good levels of collagen, especially when combined with glutathione. Zinc would be helpful. You have heard about zinc deficiency. You can have white nails. Especially for me, because I'm an obstetrician, I see a lot of striae in women after delivery or during pregnancy. And when do you get striae? The reason is because one is deficient in vitamin C, so there is less collagen, zinc deficiency, and growth hormone deficiency. You get lots of striae. You need to make sure there is sufficient amount of essential fatty acids, maintain the ratio, I'll be finishing soon, maintain the ratio between omega-3 and 6 to 1:2 or 2:1. Vitamin E helps with keeping the skin supple and moist. So these are the supplements, and there are many other things you may want to consider, including B vitamins. So this is a short lecture. Thank you very much. We can start early for the next lecture. And any questions? Yes? 400 to 800 milligrams a day. Better to have the mixed, all the 8 types. Don't take 400 to 800 milligrams.
In correcting hormones, how do you go? You start with thyroid, and when do you start giving the growth hormone?
Okay, the question is, in what order do I replace the hormones? I don't use all the hormones at one go. I prefer to correct thyroid. The teaching is generally you correct the adrenal first, then you correct the thyroid. But what I do in my practice is I correct these two simultaneously. Correct the adrenals and correct the thyroid hormones. let them get used to it. But remember, whenever you give DHEA, tell them about oily skin, acne, and facial hair. So you don't get into trouble. When you give thyroid, tell them how to notice too much thyroid in them. That's quite simple. So I call them back a month's time, I assess. Okay? That is the time I introduce other hormones if they are deficient in progesterone or estrogen or testosterone. Usually I do not use estrogen because majority have already got excess estrogen in the body, although it's synthetic, okay? When do I use estrogen is when a woman comes to me with dry vagina and hot flushes. I prefer this, but I'll correct the progesterone. And remember, if you add a small dose of progesterone to any woman above the age of 40, they have much less risk of cancer of the breast, uterus, and ovaries, including the benign tumors. Then only I will add growth hormone. So growth hormone is usually the last one to be added. But of course, not everybody can afford it because it's a bit expensive. Yeah? Yes? You don't give growth hormone in patients with cancer. It's better you control or correct the hyperinsulinemia first before giving growth hormone. And if you want to be even more thorough, detailed, then you may want to do the circulating tumor cells first, because you don't use growth hormone in someone who has a high count of CTC. You manage that first, then you can use growth hormone. Cancer, definitely contraindicated. Hyperinsulinemia is relative contraindication. High CTC count would be a contraindication unless you have ruled out existing tumors.
What is the dosage of progesterone application on the breast of men?
If women take 100 to 200 milligrams a day, general, okay? If you are just correcting you are balancing estrogen progesterone. If you are treating ovarian cysts or fibroids, you may go up. It doesn't matter until you remove, there are no more symptoms like heavy painful period, PMS, and you see changes in the tumor. Fibroid, difficult to shrink. You may stop it from growing. You can stop the risk of getting more fibroids. Ovarian cysts can shrink. That dose can be anything between 300 to 600 milligrams. For breast, as little as 50 milligrams will do. You just try a small dose, maybe 25, maybe 50, and see the response. And this treatment is not for long term. As soon as you have reduced the size, then the rest of it comes with diet and exercise and watching out the source of xenoestrogens.
If we have a patient with very low insulin, and from genetic test, it confirmed that the patient has a very low insulin secretion. So for this kind of patient, how to give them insulin? Thank you.
The dosage, I suppose, should be what controls the blood sugar. And niacin, especially the hexoniacinamide, am I right, Ashley? Can help insulin secretion. But of course, you got to manage the diet well. But niacin, the studies done so far shows that if you start early, then it helps. Established insulin deficiency cases, you can still try if, after all, it's not toxic. But the dose depends on the blood sugar level. There is no fixed dose.
Selvam,
Yes.
if the insulin is very low, sometimes these people have very low ornithines. And giving them some ornithine, the amino acid ornithine, can help raise the insulin if it's very low. Because some people with very low insulins might get quite dizzy and lightheaded, and ornithine can help some of those people.
And the dose?
Somewhere between 500 milligrams and 1,000 milligrams. I mean, you start low and build it up and see how it goes.
Okay. Thank you, Ashley.
How would you handle a case with low thyroid but elevated DHEA sulfate?
Low thyroid?
Yeah, low thyroid hormone, and then elevated DHA sulfate.
Are you asking me what is the connection?
Yeah, how would you handle? How can you?
Okay. Low thyroid, you just correct the thyroid hormone deficiency. And if the DHEA sulfate is elevated, of course you can see oily skin, pimples and hirsutism, right? You can't control it directly. The indirect way of controlling it by giving hydrocortisone or cortisol. So because it is the feedback loop, right? So when you have cortisol, the stimulus from the central will be low. So your ACTH, when you reduce by giving cortisol, then that loop to stimulate the DHEA will also be reduced. So you control. That's one thing that you can do, because you can't stop the adrenals from producing. But by increasing your cortisol levels, usually they are deficient. By increasing cortisol levels, you'll control. But it takes time. It takes about 6 months at least.
Is hydrocortisone enough to elevate the aldosterone?
No, hydrocortisone is cortisol. Aldosterone is a totally different hormone.
So no other
You
choice?
have to, yes.
Fludrocortisone.
Fludrocortisone, yes.
Thank you.
Sorry, one more question. For hyperthyroidism,
Hyper,
yeah, the opposite of what
Okay.
happened, yeah. So the patient always having palpitation at night and it's very bad, and she got the beta blocker. How to control that? Only with cortisol balancing, and what else?
First, remove gluten. Totally remove gluten.
Already done.
Within a month, the thyroid hormones will start to normalize, including at some point in time, it takes a little bit more time to bring down the autoantibodies, thyroid antibodies. Okay. The reason why they get palpitation, it could be because when you have a thyroid disturbance, you have an adrenal disturbance.
Yeah.
So if one is cortisol deficient, the body will compensate, because I told you yesterday, the body is very intelligent. It finds means and ways to compensate the acute problem. So what does it do to correct the acute cortisol deficiency is by producing adrenaline. So when a person is cortisol deficient, the anxiety, the palpitation, the sweaty palms, and the anger, it's actually adrenaline effect. And this disturbs sleep. So if you give melatonin to someone and they can't get adequate sleep, even with melatonin and GABA, it's probably because they are cortisol deficient. So by correcting cortisol deficiency during the day, then you avoid the problem at night. But cortisol deficiency correction, it should be in the morning and one dose at midday. If you only correct it in the morning, you leave them deficient for the rest of the day. So you just need 2 doses, unless in acute situations you give them 3 doses. But the last dose preferably at 6 and at a smaller dose, because it can disturb sleep.
And the beta blocker should be continued?
You can use on a PRN basis as and when needed, but it is not a long-term solution. The long-term solution is to reduce the thyroid hormones naturally, remove gluten, yeah, and balance the cortisol.
Okay, thank you.
Okay.
How about if both your DHEA and cortisol are elevated?
Change the diet and send them off somewhere for a holiday, balance the stress. Yeah, but then many of these patients actually, if you assess them clinically, they'll have all the symptoms of cortisol deficiency, because coming to your clinic in a fasted state and waiting there to see a doctor and the fear of needles actually just elevates, although they could be cortisol deficient. So I actually, because I'm a clinician, I will touch and feel the patient, talk to the patient, I'll elicit a clinical history. I just do not rely on blood results alone. If I'm doubtful, I'll repeat it. But if they have elevated levels of both, then you just have to calm the adrenals. Rest, adequate sleep will help. Diet will help. Holiday, staying away from work or reducing work stress will help. and supplements can help. One of the supplements that can help is ashwagandha, which is an adaptogenic. Yes.
How to give growth hormone?
Growth hormone is a subcuticular injection. It has to be a subcuticular injection. And of course, now you have IGF-1 itself. So we have IGF-1, then we have IGF-2 now, and maybe even IGF-3. But these are very potent. So we don't resort to IGF-1 because it's still new. You will have to wait for much longer time to see the safety. Whereas when you give growth hormone, it has to be, the liver gives you the IGF-1, right? So you maintain good health, a healthy liver. So the conversion will take place. Growth hormone is always an injection.
How often?
Just like the insulin. You take it at night before you sleep.
Every day?
Yeah. Or you can take Monday to Friday, skip on Saturday, Sunday. I prefer this skipping Saturday, Sunday because I don't want to make the body too lazy. Yeah. Yes.
How do you bring down the hyperinsulinemia in any patient? What is the main thing is the carb and the sugar.
Yeah.
What else can we do? The other thing is vitamin E. Can we take every day? Is there a toxic limit to vitamin E?
So first question is, how do you bring down the insulin?
Insulin.
Very simple. Why does your body produce insulin? Only when you take carbohydrates, right? So you limit that, then there is no reason to have excess insulin. But sometimes you have insulin resistance that has been existing for a long time. Supplements can help, B vitamins can help, zinc, chromium and magnesium can help. Exercise and losing weight will help. Hormones like testosterone will help. Significant improvement in insulin resistance and diabetes. Growth hormone, you will have an elevation first, then it will settle down. So these are the other options you have. But the primary reason why your body produces too much insulin, unless you have an insulinoma, which is very rare, is because of your consumption of carbohydrate. Vitamin E, it's fat soluble, yes. So 400 to 800 milligrams should not give you any toxicity daily. Okay?
Can we boost our human growth hormone by intermittent fasting?
You can. Calorie restriction can also increase growth hormone. Sleeping early, melatonin, weight-bearing exercises, cutting out sugar, all this will help. But they will help to increase. Do you still correct the growth hormone deficiency as you age if you are deficient? In my opinion, you should, because I said it at the very beginning of the lecture. Hormones you can just have within the reference range. That does not stop you from premature aging. You are better off than someone who's below the reference range. So you want the benefits, then you are talking about optimum levels for optimum health. Is as simple as that. So if you want optimum levels, you can do all this and you repeat your bloods. If you reach the 25th centile, you don't need it, but it is tough. Usually you need to supplement with hormones itself. Okay, so let's have a break now.
One question
yes.
maybe?
One more.
Yes,
I have
okay.
one question.
Okay.
So I want to understand the hormones that you prescribe, is it very close to identical to our body? Is it very safe?
Okay, yesterday you were not here.
Yes.
Were you here yesterday for the lecture when I put up a slide on bioidentical hormones? Okay, there are two types of hormones. The fear of taking hormones is, this is the reason. Number one, the fear of it being a steroid. So this is misunderstood. Almost all your hormones, not your thyroid, not your growth hormones. The rest of the hormones are steroids. So there are two types of steroids, natural steroids and synthetic steroids. You only hear about synthetic steroids because that's what pharmaceutical companies will sell. That's the one they can patent. Natural hormones cannot be patented, so they have no interest in natural hormones. Number two, when you have natural hormones, when we say natural, that is similar to the same molecular structure as what you have in the body. So either you get it from natural sources itself, like progesterone, or it is made in the factory but the same molecular structure. When you change the structure, then it becomes synthetic. This is what the pharmaceutical industries will do. Okay? So these synthetic hormones are the contraceptive pills, for example, and then women who have excessive menses, we have synthetic progesterone, and you have the HRT, hormone replacement therapy. Okay? So what we call these hormones as bioidentical hormones, identical to your biology. So either they are from natural sources like plants itself, or they are made in factory. As long as the same molecular structure, chemical structure, you consider them as natural. Don't worry about steroids. Yeah?
Thank you.
Okay. Yes?
What is the dose of melatonin? Is it depends on decade or only like 1 milligram until 5 milligram?
You can take a higher dose, like for example, if you have a brain tumor, because you need a lot of melatonin as an antioxidant, you can take a higher dose. If you are treating cancer patients, like what Ashley said, you can even go up to 20 milligrams. Generally, 1 to 3 milligrams would be sufficient for adults. But when you are traveling, if you want to avoid jet lag, you need a higher dose. I don't think there is a maximum dose, because we don't know of any toxicity with melatonin, because the moment you look at lights, it's gone. But what it does is, melatonin is, okay, if you take too much melatonin, it disturbs your sleep, as I've mentioned. You sleep well for 3 hours, maybe 4 hours. After that, it's difficult to fall back asleep. The next morning, you will feel sleepy, groggy. And melatonin in high doses can suppress your cortisol. Okay, to avoid the side effects of, say, if you have taken excessive melatonin, if you don't feel energetic the next morning, if it is because of melatonin, go out and get some fresh air, look at the bright sky, and just go out of the room. Number 2, you take hydrocortisone. You will avoid. But as far as I know, there is no toxicity even at very high doses, and there is no upper limit, because depends on how much you require to have a good sleep, 6 to 8 hours. Local application?
Among those so many hormones, which one or two that the most impacting to lifespan, adding years to our life?
The most important. Okay, you don't want to have too much of insulin, that you can control yourself. There is no active treatment needed, because you just need a disciplined self. You don't need to spend money. If you ask me which would be the hormone that gives you the vigor, the energy, you have to look at testosterone. Testosterone. First of all, ensure that you have adequate thyroid hormones. That's very important, because this is why we call the thyroid gland as the master of orchestra. So you ensure that you have thyroid hormone, not so much for aesthetic purposes other than weight gain and dry skin. 2 hormones that would be very useful. One is very, very useful, would be testosterone. And the second hormone you may want to consider is the growth hormone, but it's expensive. Okay? You will not want to leave cortisol deficiency untreated. It's also not expensive. If you want to manage your sleep, your lifestyle, and your diet, rest and relax and be happy and laugh, and like what Marcus said, integrate, connect with people, be connected to the society, have friends. All this would be helpful. If you can manage, you don't need cortisol. So consider testosterone and consider growth hormone. Testosterone itself will have a significant improvement in your health. Okay? You are saying something, Sanjeev?
No, to answer this lady's question about melatonin, like especially with psychiatry patients who have got depression and sleep disturbances, one of the key reasons is they don't make serotonin. And 5-hydroxytryptophan is a precursor to serotonin, and serotonin makes melatonin. So you have to look into that aspect. So if a person has got depression signs and it is quite severe, I use one of my favorite antidepressant is agomelatine, AGOMELATINE. I don't know whether it's available here or not, but 25 milligrams. Now this combination is raises serotonin levels, but it is also pro-melatonergic. Bioavailability of melatonin in this combination is almost close to 80 to 90%, which means that you will achieve very high levels and it will do the same job. What I do, since I studied nutrition, I add magnesium to it because magnesium increases the half-life of melatonin. So that would help. So that's something which I use quite often with successful outcome.
If you want to improve sleep, you can add 5-hydroxytryptophan and add magnesium at night. 5-hydroxytryptophan and magnesium, you can take it with dinner and ensure you have adequate vitamin D3 levels, and take melatonin when you want to sleep. But in depression, you can use 5-hydroxytryptophan even twice a day. So sometimes if you have a patient whose mind doesn't settle down, you add GABA. But GABA, 5-hydroxytryptophan, magnesium, even melatonin will not have significant improvement in sleep, a significant effect in improving your sleep if you are cortisol deficient. So when you have given all these, if someone's still not able to get good sleep, look at correcting cortisol deficiency in the morning. Okay? So we'll see you back after the break.